Hi class, this is Dr. Heather Austin Robillard again, and this short little lecture video is just going to give you some more information about writing exercise number 2. While writing exercise number 2 is going to look similar to writing exercise 1 in that you will be doing a role play, you will be asking your client information and questions and interviewing them, and then you will be turning in the assessment paper. However, there are some differences. You're going to be utilizing some specific screening and assessment tools that we've learned thus far. You will not have to record your video and upload that to Blackboard. So all you're turning in is the consent form, the intake sheet or interview questions, the screening and assessment tools filled out by your pretend client, and also your assessment paper or your evaluation paper. So when we go over to the writing exercise 2 checklist, you will see that the information is fairly similar. Again, you do not have to record your role play information. However, you will want to upload several documents at once in your assessment or in your assignment. Now, as you can see from the checklist, the things in red are the things that are instructor notes, so things you want to be cautious of before you even begin the role play or assessment paper. The things are in blue are things that you will need to add into this substance abuse evaluation paper that you didn't do in your previous one. Let's take a look at some of the new items in this writing exercise that aren't found in writing exercise 1. The first part is the specific assessment tools you'll be using in this writing exercise that you maybe didn't use in the first one. One, you'll need a couple required. So you need a measure of motivation for change. You'll need at least one substance use disorder screening, but I would advise you to do a battery of tests, as well as you might need to do more than one type of screening tool depending on the types of drugs they use. For example, if they use both alcohol and cannabis, you might want to have a screening tool for both. You will also be using the Addiction Severity Index. And you will need to gather information and use screening tools if there is a risk for withdrawal, suicide-related questions, or trauma-related questionnaires. With all of these screening assessments, you will be adding those to the addition of the assessment paper in specific domains. So there is a domain for risk assessment, so you'll want to make sure that you have enough information to elaborate on what the client's risk is. You will have a section on motivation for change. And another difference in this writing exercise is you will want to talk about the client's strengths and some other protective factors that might prevent them from relapse or help them be successful in their treatment. And then you'll have the diagnostic screening tool, which you have practiced in one of your activities, and then write a summary of all the information gathered before you discuss your diagnostic and recommendations for treatment. So just some advice, since there will be no video required for this activity, you do need to make sure that you're asking enough questions of your pretend client and enough follow-up questions to gather the data in order to elaborate in your substance abuse evaluation. Remember, you do need to do a different pretend client than you did in your first writing exercise because we're gathering different types of information. Also, it's important to make sure that your client understands that they need to have an actual substance abuse evaluation to help you give the best information for this class. So make sure that if you're utilizing a friend or a family member, they know to pretend to have a substance use problem so that they can answer those questions as if they actually have one. I'm not assuming that you have friends and family that you're actually interviewing with substance use problems, and that's really not ethical to do anyways. So we want to make sure people are pretending so that way it gives you the best information to write up this substance abuse evaluation. Thank you and have a great day.